Hi guys, Heather here. So not only can nursing school be academically challenging, but some of us might have to overcome social challenges as well. Being a nursing student can be intimidating at first, or maybe for the whole duration of nursing school, because we feel pressure from our nursing instructors to do well. And we don't want them to think that we don't know anything, even though we don't sometimes. Some of us might try to avoid them as much as possible so we don't get interrogated in the hallways during clinicals. But even if you do run, they'll catch up with you at some point, like when you're given meds in the morning and they ask you what the aspirin's for, and you're trying to think of what aspirin really is for, and the only thing you can think of is it's for a headache. I really seem to have no clue that aspirin was used as a blood thinner, but who goes into nursing school knowing it all? That's why I was there, to learn what aspirin is used for, and to learn the role of a nurse. Another social challenge as a student could be interacting with nurses that don't like being around nursing students, or teaching, and kind of forgetting what it was like when they were a nursing student. All of us at one point knew absolutely nothing about nursing. Back in nursing school, there was a nurse that I was actually kind of afraid of. She just didn't seem that nice and didn't seem like she really liked nursing students. So lucky for me, one day I was assigned to her patients and I was super excited. We had a dementia patient, and so I went in and introduced myself to this patient. This patient's totally confused, and of course, I'm a stranger, so she's frightened and kind of starts yelling at me, telling me to leave her alone and get the hell out of her room, and I wasn't really prepared to handle a situation like that. I've never been instructed on how to get thrown out of a patient's room. Then I go out of the room all upset, and I tell my nursing instructor, and my nursing instructor gives me a different patient, and then the not-so-nice nurse. So the not-so-nice nurse says, in a very sarcastic way, "Welcome to the world of nursing. I wish I could pick my patients." And she said it really evil. But she was right, we can't really pick our patients. But the key I've had to learn was to just let insults roll off your back, or you're always going to be offended about something. And the last social challenge may be family members. It can be kind of intimidating when 6+ family members are sitting in the room staring at you like you're an alien and waiting for you to say something profound, or they have 50 million questions and some answers you may not know. But that's okay. Just be friendly and as accommodating as possible, and if you don't know the answer to a question, say, "I don't know, but let me go find out for you." And just know that you can't always make everybody happy, but just try your best, and if they're still not happy, then that's on them. You just go about your merry way. So some of you might have your own social challenges to deal with, but eventually you'll learn how to respond appropriately. Well, thanks everyone for watching. Talk to you later, Kay. Bye.